Good morning, everyone. It's Wednesday, May 20th. I'm Stephanie Haney. This is 3 News Now, your early update for the day. There are a lot of interesting ideas to talk about today that are topping the headlines on WKYC.com and our WKYC app. Of course, we're going to address the changes the Governor Mike DeWine made yesterday to what was an order and now is a health advisory. Also, a study out of Europe that is looking at different models for lockdown that could combine helping economies with stopping the spread of COVID-19. But those different models have us in various stages of lockdown for potentially the next 2 years. So we'll take a look at that. And also, the way one business owner in Chagrin Falls is working to keep people safe when they come into the store to do things like try on clothes, which are all things that we now have to think about in 2020. So first of all, we will start with the updated numbers from the Ohio Department of Health that came in yesterday at 2 p.m. so you can get an idea of where COVID-19 is here in the state of Ohio right now. So with those most up-to-date numbers yesterday from the Ohio Department of Health, we saw that new cases are down from the day before, but the number of daily reported deaths was almost double from the day before. So we're talking about Tuesday numbers. So we're talking about the comparison from Monday to Tuesday right now. So yesterday, we saw 498 new reported cases of COVID-19. Again, that's based on that expanded CDC definition that includes both confirmed positive cases, but also probable cases. And that brought our total cases here in Ohio to 28,952. So it's very likely today that we will probably break the 29,000 number for confirmed total COVID-19 cases here in the state of Ohio. Now, those are not active cases, but those are cases that have been reported since March 9th, since we first became aware of COVID-19. And just a reminder again, why we are tracking these daily numbers is because what we're looking for is a downward trajectory that's at least 14 days. We haven't seen anything close to that so far. So that's the importance of why we're tracking these daily numbers. The total number of deaths now in the state of Ohio is 1,720. Yesterday at 2 p.m., there were 63 new reported deaths. That was up from 32 new reported deaths on Monday, so almost double. And the number of reported deaths each day has really been up and down. There's been no rhyme or reason to what's been going on with those number of new reported deaths. We'll see a drop for a couple days, and then we'll see a large spike. And yesterday we saw almost double the number of reported deaths from the day before. In terms of the number of hospitalizations, yesterday there were 119 new hospitalizations reported and a total of 913 people actively in the hospital, which brought our total of hospitalizations throughout the entire known existence of COVID-19 in Ohio to 5,117. So about 20% of the people who have been reported and known to have been hospitalized with COVID-19 are currently in the hospital right now. If we look at intensive care unit admissions, the number of total intensive care unit admissions for COVID-19 in the state of Ohio is 1,357. The number of people who are currently in the intensive care unit for COVID-19 in Ohio, as of yesterday at 2 p.m., is 365. Yesterday, we saw 29 new ICU admissions reported. So as people are admitted and discharged on a day-to-day basis, yesterday we saw 29 new reported, but that number has stayed pretty consistent for the number of people in the ICU. On Sunday, there were 343 people actively in the ICU. On Monday, there were 367, and then yesterday, 365. So as we keep track of all these numbers, yesterday, Governor Mike DeWine announced that he is changing restrictions for individuals. Now, if we think about this logically, this only makes sense because retail stores have been able to open, patios were able to open last weekend. This weekend, indoor dining will begin to resume, so it only makes sense that people will not be ordered to stay at home now that these places are open, where the state would like people to frequent, would like people to support local businesses. But it's a little bit confusing because we want the economy to reopen, but the governor is still saying that it's recommended that people stay home. It is strongly recommended in some cases. So let's talk about the health advisory that he put out yesterday. This is called the Ohioans Protecting Ohioans Health Advisory. DeWine said that we are now moving from orders to strong recommendations. It's a new phase in our battle against COVID-19, and it is on each of us to protect each other. So it's 5 parts. So the new advisory will incorporate, again, that 6 feet of physical distance and a limit of 10 people for mass gatherings, and of course, frequent hand washing and other sanitation efforts. It also incorporates the business orders about physical distancing and sanitation and the fact that all employees are required to wear masks, as well as protect employees and efforts to keep the public safe. The advisory also strongly recommends that high-risk Ohioans stay at home as much as possible and that they should avoid places where they're likely to encounter a lot of people. Now, here's where things get a little bit confusing. The Urgent Health Advisory recommends but does not require that all other Ohioans stay at their place of residence when possible with the intent of lowering the spread of COVID-19. So it's recommended that people stay home. It's strongly recommended that high-risk people stay home. And when it comes to travel, there were previous orders that were limiting travel, but under this advisory now, those limitations will be lifted. Unnecessary travel within or outside the state of Ohio is permitted, but it is not encouraged. So again, as we take a look at this change, of course, as things reopen, it only makes sense that people will not be ordered to stay at home, but it is strongly encouraged for high-risk individuals. We're looking at older Americans, people with underlying health issues, people who are immunocompromised for other reasons, maybe they're taking an immunosuppressant, those kinds of things, but people who are not within those categories are recommended to stay at home. Here's an interesting idea. There is a study in Europe that is suggesting different models of lockdown and lessening of lockdown measures in order to stop the spread of COVID-19 and get it under control while balancing the needs of an economy. So, as we know, experts keep saying that a vaccine for COVID-19 may be a year away and stay-at-home measures are put in place to stop the spread of the virus, but here in America, that's also contributed to 36 million people having filed for unemployment, and that's not even accounting for the people who've not been able to file, as we know that systems have been incredibly backlogged across the country. So there's a lot of pressure to get people working again, as people are concerned about their livelihood and small businesses worry and haven't been able to access those emergency loans and all of those kinds of things. So there's a study from Europe that is now suggesting an alternating cycle of 50 days of strict lockdown, followed by 30 days of relaxing restrictions in order to keep COVID-19 deaths down and damage to the economy to a minimum. Now, this study does tend to show that fully relaxing restrictions could overrun hospitals and again put the death toll in the millions across the globe. So Dr. Chowdhury, who is a global health epidemiologist at the UK's University of Cambridge, said this: "This intermittent combination of strict distancing and a relatively relaxed period with efficient testing, case isolation, contact tracing, and shielding the vulnerable may allow populations and their national economies to, quote, breathe at intervals, a potential that might make the solution more sustainable, especially in regions that do not have a lot of resources." So this study was published in the European Journal of Epidemiology, and it looked at 3 different scenarios across 16 countries. We're looking at Africa, South and West Asia, Australia, Western Europe, North America, and South America. The US, however, was not one of the countries considered. Now, there are multiple models that were looked at. So let's take a look at the first one, where no lockdown measures are put in place. That resulted, of course, in COVID-19 patients overloading intensive care units in nearly every single country, and the countries were not able to handle it. This is based on a study. The study projected in that case, with no lockdown, 7.8 million deaths in just those 16 countries, and that's not the worldwide toll. And that would put the epidemic lasting 200 days in most countries. Now, they had another possibility that they looked at, a rolling plan of 50 days of not necessarily totally strict lockdown, but mitigation measures, and then 30 days of relaxing those mitigation measures. But that, the study also projected, would not be enough to keep ICUs from being overrun and preventing healthcare officials from being able to treat the people that need to be treated. That model, according to the study, would work for 3 months, but would ultimately result in 3.5 million deaths in just those 16 countries, and that would have the pandemic lasting from 12 to 18 months. The third model that they suggested, this 50 days on, 30 days off situation, that would keep ICU demand, according to this study, within a level that all countries could handle, and it would keep COVID-19 deaths down across those 16 countries to a projected 130,000, but it would extend the pandemic beyond 18 months in all countries. Another option that the study did look at was 3 straight months of strict and total lockdown. And they looked at that, and that, of course, would reduce the number of COVID-19 cases in the study to 0, but they found that that would not be sustainable due to the effect on economies. I don't know where you fall on this. I know it's definitely a difficult issue to think about, but geez, this thing expanding for 18 months to have 30 days of reprieve in the middle, just from a social standpoint, doesn't sound great to me. Now, I do understand the economy is a serious consideration, so that's something to consider. And I'm not the one to be making those decisions because I don't know where the weight should fall on that. It's definitely complicated. If you want to read more about that study, it's on WKYC.com and our WKYC app. Now, as we look at reopening and try and figure out how we can navigate this, how we can go to places and support local businesses, but also keep ourselves safe, something that our Verify team looked at is, can the coronavirus be transmitted by speaking? The answer is yes, it can. Not in every single case, but it is certainly possible. It depends on how loud a person speaks, whether that person, of course, is infected or not, and how close individuals are to each other, among other things. So speaking some words, you may not be surprised to know, does generate oral fluid speech droplets. Have you ever been talking to someone and accidentally spit a little bit? Your speech in that situation has generated an oral speech fluid droplet, and as we know, droplets are how COVID-19 is transmitted. So a Centers for Disease Control and Prevention spokesperson said that transition happens primarily via these respiratory droplets, and those are produced when an infected person coughs, sneezes, or, yes, speaks. Now, the World Health Organization, however, did say that while COVID-19 is transmitted by droplets, the droplets are too heavy to hang in the air, so they quickly fall onto floors and surfaces, and that's why it's very important to do those things like wear facial coverings and also be sanitizing surfaces. You can read more about that on WKYC.com as well. Now, as we look to reopening, and as many places have already begun to reopen, there is one business owner in Chagrin Falls who has come up with a creative way to help customers who are interested in trying on clothes, which is something that some stores are just not allowing right now because they don't have the capacity to protect people from potentially becoming infected from COVID-19 if someone does do something like get one of those droplets onto a piece of clothing that they try on and then don't purchase. So Lori Klopper, who is the owner of Blush Boutique, has figured something out. She has found that steaming clothing after people try it on, if they decide not to buy it, could potentially be affected. Now, according to the CDC, flu viruses, we're talking about the flu here, we're not talking about COVID-19 because that's not been studied, but flu viruses are killed by heat above 167 degrees. Steam is produced at 212 degrees and is known to kill the flu virus. So, what Lori is doing is she is steaming clothes after someone tries something on and chooses not to buy it in an effort to sanitize that clothing before someone else might want to try that piece of clothing on or purchase it off the rack without trying it on. Now, actually washing clothing is more effective, but steaming is a good alternative according to the experts because, of course, you can't be washing clothing every time someone tries it on in a place where you're going to buy clothes. It's just not possible. So Lori says that it's definitely a lot more work, and she's always got a pile back there by her steamer, but she wants to give her customers peace of mind. She's taking these extra steps to get people in there in the stores down in Chagrin Falls. So again, that's Blush Boutique in Chagrin Falls. Lori Klopper, you know that she is steaming those clothes in between everyone trying them on, so that's something that may give you a little bit of peace of mind if that's something that you are interested in doing. If you're interested in checking out the Cleveland Metro Parks Zoo's Cruise the Zoo, some good news for you. Ticketing is back online for the event. There was a lot of high demand around this online ticketing, so it temporarily shut down their reservation system, but Now it is back online, and this is the first time you've ever been able to do this at the Cleveland Metro Park Zoo. You can actually drive through along a tour, so you'll get to see many of their animals, and there will also be ambassadors along the way that will help guide your experience. So if you're interested in doing that, that opens today. It's open from 10 a.m. to 4 p.m. Wednesday through Sunday, and that runs through May 31st right now. So it's $20 per car if you are a member of the zoo, and if you're not a member of the zoo, it's $40 per car. So a couple other things that are a part of the Cruise the Zoo experience: there's a free audio guide for families to listen to as you drive through the zoo. There's a virtual photo booth. There is a scavenger hunt where you can search for little hidden animal displays throughout the drive-through experience. And also, if you take a photo and you share that photo of yourself enjoying the Cruise the Zoo experience using hashtag #CruiseTheZoo, you'll be entered for an opportunity to win what they call an Achievement Award, and you can exchange that for free food at Raising Cane's. And apparently the audio guide, just so you know, has some tips on that scavenger hunt and what you can do with that hashtag #CruiseTheZoo in order to better your chances of winning that free snack from Raising Cane's. Now, this is something, if you would like to support the zoo, would be a great opportunity to do. Since closing on March 16th, just so you're aware, the zoo officials have said that their revenue is down more than $1 million from last year, and we know it's expensive to take care of those animals. So if you're in a position to do it, you're looking for something fun to do with the family, Wednesday through Sunday from 10 a.m. to 4 p.m., not a bad idea. And keep in mind that the last entry is at 3 p.m. and they do limit the number of cars per hour so that everyone has a nice experience when they are able to do that. Now, as we look ahead to Memorial Day coming up, Cleveland Hopkins International Airport has some safety details that they would like to share. They want to let everyone know that they have increased sanitation in high traffic areas throughout the airport. They've also installed barriers at all information and police kiosks. And in an effort to keep passengers physically distant, the airport has also marked spaces on the floor that are 6 feet apart so that people can have an idea of where they should stand in line for different things throughout the boarding process and also at check-in, baggage claim, those kinds of things. So Hopkins has also moved their only TSA checkpoint from the central to the south entrance, and there's only one open. So even though airline travel is down right now, they are recommending that you get to the airport early if you will be traveling over the holiday weekend. And keep in mind, the airport itself is not requiring passengers to wear face masks, but individual airlines are. So these are the individual airlines that are requiring face masks of their passengers: Delta, United, JetBlue, Frontier, American, Southwest, and Alaska Airlines. But one thing that does vary among those airlines is when you need to wear that face mask, whether that's required at check-in, at the boarding process, or when you're on the plane. So check with your individual airlines about when specifically face masks are required, if that's something that is important to you and you want to know what to expect before you book your travel with a particular airline. That is it for our early update on 3 News Now on Wednesday, May 20th. There will not be a press conference from Governor Mike DeWine today. He will be busy celebrating what he called his longtime girlfriend's birthday. So we won't hear from him today at 2 p.m., but I will be back here at 2 p.m. as soon as we have those updated numbers from the Ohio Department of Health and let you know how the COVID-19 cases and deaths and hospitalizations and ICU admissions are comparing to yesterday, as well as taking a look to how things look across the country and across the globe, and of course our top headlines from WKYC.com and our WKYC app. I'll see you back here in just a little bit. Everyone enjoy the rest of your morning. Have a great early afternoon. I'm Stephanie Haney.